Hello all of you. So welcome back to my channel which is Study Smart with me, and yesterday I have shared a video related to the anatomy PYQs. So now the another video is related to as same because yesterday we have discussed 5 questions. Now as in chain we'll be discussing more 5 questions towards. So let's begin with our video. So first question is a 45-year-old carpenter complains of chronic pain and stiffness on the lateral side of elbow, particularly when using a hammer. The examination reveals a positive test. Okay. So which muscle attachment is likely affected? So you can see this image too. This is the image and this is the test is performing over here. Now we have a choice like extensor carpi radialis longus, brachioradialis, extensor carpi radialis brevis, or pronator teres. So answer is extensor carpi radialis brevis. Okay, answer is this. Now we'll be discussing about the explanation. So it is the test which is Maudsley test. So you guys need to remind some sort of things which I used to tell you. Maudsley test. Okay. Now, let me explain you everything related to that. It is used for the confirmation diagnosis of lateral epicondylitis. Okay, and that is term used to be said is tennis elbow. The extensor carpi radialis brevis is the most common forearm extensor associated with lateral epicondylitis. Okay, the extensor carpi radialis brevis is the most common forearm extensor associated with lateral epicondylitis. Okay, so answer is this. What test we have used is Maudsley's test. Epicondylitis, what is now, let us see what is epicondylitis. Epicondylitis represents a degenerative process involving the origin of the extensor tendons at the lateral elbow and the flexor pronator muscle group at the medial elbow. It is thought that repetitive stress and overuse lead to tendinosis with microtrauma and partial tearing that may progress to a full thickness of tendon tear. So what happens like when we will be giving the repetitive stress, repetitive force on our elbow joint, so it can lead to the tendinosis with microtrauma. And when there is a partial tearing present, it can lead to the full thickness of a tendon tear. So then what cause epicondylitis? Lateral and medial epicondylitis are common disorders affecting the upper extremities. Epicondylitis causes pain and functional impairment and typically results from specific occupational and sports related activities. A person who is used to playing the sports, they used to give a continuous stress to their muscles, to their tendons, then it occurs at that time. Okay, lateral epicondylitis was initially described by the Morris as lawn tennis elbow, because through this we when we'll be playing lawn tennis, we'll be continuously providing stress to our elbow, right? And now most commonly termed as tennis elbow. That's why the term is also known as tennis elbow. May occur in patients performing any activities that involves repetitive supination and pronation of the forearm with the elbow in extension. So here you get the complete explanation about it. Now let me give you a brief of this. Chronic pain happened, stiffness was there, lateral side of the elbow, and positive tests we have to find out. This image also giving you a complete brief about it. So the answer is extensor carpi radialis brevis. Correct. Let's go to the next question. The thoracic duct is formed by the convergence of which structure? So you need to remind this properly. What is the answer of it? Now answer is continuation of upper end of cisterna chyli. Answer is this. We have a choice: union of left subclavian and left internal jugular vein. No. Union of brachiocephalic vein and internal jugular vein. No. Continuation of upper limb end of cisterna chyli. Yes. None of the above. No. Now let's see the thoracic duct. Let's explain this. Thoracic duct is also called as Pecked duct. Guys, I have put the explanation just because you will be learning some another points also, some another one-liners also. Okay, so this is not only we are discussing one question, we'll be discussing multiple questions through one question set, right? It is the largest lymphatic duct in body, about 45 centimeter and 18 inches long. It has a beaded appearance because of the presence of many valves in its lumen. Thoracic ducts begin as a continuation of the upper end of the cisterna chyli. You have to remind this point anyhow. So your answer is resolved over there. Near the border of T1-2 vertebra and enters the thorax through the aortic opening of diaphragm at T12. It then ascends through the posterior mediastinum. After that, what happens? It will be ascending to the posterior mediastinum and at T5 level crosses from right side to the left side and ascends along left margin of esophagus to enter the neck. At the level of C7 vertebra, arches towards left side to open into left brachiocephalic vein at the angle of union of left subclavian and left internal jugular vein. Okay, so at the level of C7 vertebra, what happened? It will be arches towards the left side to open into left brachiocephalic vein at the angle of the left subclavian and left internal jugular vein. Okay, you got this point, right? Now you have to remind this answer. Let's come to the another question of this series. I hope you guys are liking this. So please do share this with your friends. The question 8 is which vein is associated with the paraduodenal fossa? See this. What is the answer? Inferior mesenteric vein, middle colic vein, left colic vein, splenic vein. Answer is, yeah, you guys are right. Inferior mesenteric vein. Let's see the explanation regarding this. Inferior mesenteric lies in the free edge of the peritoneal fold of paraduodenal recess. Where it is IMV. Inframesenteric lies in the free edge of peritoneal fold of paraduodenal recess. Got it? The inferior mesenteric vein is responsible for the venous drainage. So it is responsible for venous drainage. Okay, of rectum, sigmoid, and descending colon segments. Correct? Venous drainage of what? Rectum, sigmoid, and descending colon segments. Now what happened? It starts at the level of the anal canal as the superior rectal vein with confluence to inferior and middle rectal veins around rectal plexus. So from where it starts through the anal canal at the superior rectal vein with confluence to inferior and middle rectal veins around rectal plexus. Okay. Now the ninth question. You remind this, right? Paraduodenal fossa is inferior mesenteric vein. Paraduodenal recess. Here I have given you the explanation. Let's come to another question, guys. The right half of the diaphragm, known as the right hemidiaphragm, receives motor innervation from which of the following nerves? Right half of the diaphragm, known as the right hemidiaphragm, right, receives motor innervation from where it receives the motor innervation from which nerve? So answer is right phrenic nerve. Yes. Answer is right phrenic nerve. Now let's see the explanation towards it. The right phrenic nerve passes over the brachiocephalic artery. Let's write this in a short way. What happened? Right phrenic nerve passes over the brachio, sorry, cephalic artery. Okay, from there it passes. Now what happens? It passes over the brachiocephalic artery, then posterior to the subclavian artery. Posterior to subclavian artery. Sorry, subclavian vein. I'm really sorry. Subclavian vein. And then what it do? It crosses to the root of the right lung anteriorly. Where it crosses to right lung anteriorly. Okay. And then it leaves the thorax by passing through vena cava hiatus in the diaphragm. What level it is? Yes, TA. So, like in this way, if you will be writing, na, you will be reminding everything. So you try to write, you try to take a pen and paper with you whenever you are solving any question or you're learning anything. So this is the image I have covered. You have to go through with this image too.